Dockerbo, towards a better quality of life.
Hello, my name's Trish. I'm one of the community heart failure nurses in St Helens. I feel there's been real benefits in adopting this telehealth monitoring for patients. These patients have long-term chronic conditions and they need surveillance in order to manage it better and more thoroughly. We can then increase medications that are evidence-based in order to manage that chronic disease pathway much better, avoid hospital admissions and get these patients as well as we can do. It's providing the patients with more knowledge, more education around their own disease, and they have that independence then. We found that they trigger more appropriately, so they know when they're decompensating and we can manage those things quicker and nip things in the bud more efficiently.
Okay, my name is Peter Morris and I'm suffering from heart failure. I was first diagnosed with heart failure in 2014 by my GP and the subsequent referral to Warrington Hospital.
This gentleman has been in the service for a number of years. He's had chronic heart failure in conjunction with a number of other chronic diseases, so he's quite a complex patient. He's actually now been referred to our palliative care services, and this is for symptom control. So the introduction of this technology was really good for him, and he's seen it as a positive. We can manage it remotely, we can alter medications remotely, and we can monitor blood results. This is all there to help his symptoms.
I found Dockerbo to be very helpful, and the reason for that is that I no longer have to go in and report my condition. For example, just last night I suffered a bit of a flutter on my heart, and I put that down in the information to Dockerbo, and whilst I was out in the car this morning they phoned me up to inquire exactly what it was, if there were any other side effects, and it's knowing that they are on the job straight away that gives you peace of mind. So it's made my life a lot easier and also left me feeling a lot more confident that if I need help, it's literally round the corner.
Yeah, I feel that this gentleman has benefited from telemonitoring in that his previous observations were never recorded. So now we are able to access the dashboard and we can look at the trends, and in heart failure that's really important. It's not about the one-off observations, it's about the trends and the response to alterations in medication. So that is giving him the confidence because he knows that somebody is watching that, and we can then liaise with our clinicians and either upscale that monitoring or decrease that monitoring accordingly.
A daily routine, I take blood pressure, blood glucose levels, oxygen, pulse. I think that's about it. Write everything down, and then I put it into the data screens on the phone that you provided me with and send that off. Then just leave it, I don't switch it off. I found that the phone will go all week on one charge.
Dockerbo app also supports a selection of Bluetooth peripherals.
My name's Dr. Greg Irving. I'm the research lead for St Helens CCG and one of the GP governing body members. So using the Dockerbo service allowed us to ensure that those patients with heart failure, who we know have complex needs and have a very unpredictable disease trajectory, that we could make sure those patients receive well-coordinated care in a timely fashion, and we knew that they were being monitored safely. There's been good satisfaction from a clinician point of view as well. We found, I'm speaking as a GP, we found that it's not really increased the GP workload, which is important at this current time, and if anything it's offered something in addition to the usual care that patients receive. So we've ran a number of evaluations of using Docebo services locally. One of the most recent ones was the COVID oximetry service, and the individual patient feedback that we got was overwhelmingly positive.
I would strongly recommend it, in all honesty. It gives you a lot of peace of mind, and it takes away the complete ache of having to go into hospital or report to your doctor on a very frequent basis, to say the least.
I think that was one of the surprising things, how quickly the patients adopted using the technology. Even some of the elderly and frail patients were quite keen to use the technology and used it often without much difficulty. So one of the big strategic areas and priorities for the future is developing the NHS at home services, which focuses on the delivery of telemonitoring services at home for patients with chronic diseases. And we recently undertook an evaluation looking at the barriers and enablers to doing that at scale, looking at a whole range of conditions. And obviously in St Helens we're using the service for heart failure and COPD, but there's huge potential for using the services for other disease areas, such as for hypertension and for type 2 diabetes and mental health. Yeah, so diabetes is a particular challenge, and there's almost an epidemic particularly of type 2 diabetes. So thinking towards the future, having access to care for patients with monitoring services for patients with type 2 diabetes could be something that we would definitely consider in the future.